How much should people pay for their health? How much should you pay for your health?
At least $1.
I know they got the money there. Like, I just want to say, if they just stopped spending so much on their military to terrorize the rest of the world.
How are your prisons more well funded and a better environment to access healthcare?
Hello, Globies. Welcome to the World Health Investigation podcast. My name is Jocelyn.
I'm Adna.
And I'm Loza.
We're three young global health professionals and your hosts for the World Health Investigation podcast.
Also known as the WHI, we'll be discussing all things global health and unpacking the most controversial health and social issues,
as well as promoting new wave global health development and equity.
So, ladies, what's the tea in global health today?
What is the tea?
What is the tea? Who is spilling the tea today? What are we spilling?
Right? Tell us, Jocelyn.
Am I spilling the tea?
You spill the tea.
I'm spilling the tea? Okay, let me tell you. I'm going to ask a very generic question. How much should people pay for their health? How much should you pay for your health?
At least $1.
I was going to say $0, please. I don't have money.
Personally, I don't want to pay for nothing, anything, absolutely nothing.
Nothing.
But the truth is, we live in a world where, we have to pay for everything. We have to pay for existing.
Everything has a price.
Everything has a price.
Right. And we're going to find out what that price is. So usually as young people, we don't tend to think about the price of healthcare. We don't think about the cost of healthcare. Because if you grew up, let's say middle class, high class, maybe not low class, your parents probably paid for whatever health insurance system you had, or probably made sure that you were okay and you were alive. That's why you're alive today, right? So you didn't have to worry about it. But as you grow up, you start to realize that it costs money. Healthcare costs money. And it costs
Edna, the way you said that is so
So we're going to dive into a bit of that and how we're going to address it and the whole concept behind universal health coverage. So,
okay, we're going to be educated today.
Yeah, we're going to break down what universal health coverage is, and then I'll give you an example and we'll look at a case study. So, universal health coverage is the principle that all people, no matter their social, economic, geographic conditions, have access to essential health services at low or no out-of-pocket cost to them. Essentially, the goal is to prevent healthcare from pushing people into poverty.
That makes sense to me.
Healthcare.
Beautiful, right?
Beautiful concept.
I like it.
Wonderful. If I'm poor, I should be able to access health, right?
Right. It's a
beautiful. If I am Black, Latino, I should be able to access health, right?
Yeah.
That makes sense to me.
Yeah.
That makes sense to me. But the reality is, what happened? Let's find out. So we're gonna look at this example. I was watching Chicago Med. I don't know if you guys watch Chicago Med. Whoever has watched Chicago Med.
I have heard of it.
You've heard of it. I love it. I was obsessed with it. But it was in this episode where this man, right, he got in his car and on his way, he hit this person, and the person got into a traumatic injury, was brought to the hospital, and they couldn't get saved and died, right? So eventually we checked and we see that this guy was trying to hide from his wife about his admission to the hospital. The guy that hit the person was trying to hide from his wife that he went to the hospital with somebody. So essentially the doctor tries to find out, like, why is he hiding from his wife? Why is he there to hide? So the wife finds out later on that, okay, my husband has been hiding this from me. And it turns out that this man had cancer.
The husband
that hit the person.
The husband that hit the person has cancer. Okay. And now this man is about to go to jail. And the doctor said, no, I don't want to go to jail. But he's going to jail because he hit this person, the person died, right? And he's about to go to jail. And the doctor is like, no, I don't want my patient to go to jail because essentially he was trying to protect this guy. But the guy's just surprisingly just like, I don't mind going to jail. I just want to go to jail. And like, it doesn't make any sense. The doctor was like, do you understand the implications of your actions? If you give yourself to the police, you will go to jail. He said, yes, it's fine. I don't mind. I mean, it happens. I deserve it. And then it turns out that he was saying no. The doctor put the pieces together that he was saying that he wants to go to jail because he knew the whole time that he had a cancer. Because when he told him he had cancer, he said, I knew a long time ago. And he knew that going to jail would get him free healthcare, free treatment for his cancer.
Huh?
Yeah.
I'd rather go to jail.
We went through so many tests. I said, oh.
He would rather go to jail.
Because otherwise there's no way he'd get treatment.
Yeah, he can't afford it.
He can't afford the treatment. He can't afford the treatment. So knowing that in the Chicago prisons offer healthcare, and they offer, I think, mostly free healthcare, especially for cancer. So he knew that he would afford it. He would not afford to access it in jail. So yeah, that's one of my favorite episodes because it just highlights the extent to which people would go to get healthcare, even go into crime to get healthcare. Because it's not like he purposely hit someone.
Someone who died.
Hey.
It's
America.
That's like America. That is America. Anyway, child, that country. Okay, interesting.
Okay, so that just makes me, I don't know, it makes my body itch. I don't know about you guys, but it makes my body itch. I want to ask you ladies, do you understand where he's coming from? Or do you relate in any way, shape or form? We don't judge here. Or do you understand the importance of universal health coverage and how can we link it to this example?
Yeah.
No, girl, that's deep. I mean, I've never been in such a desperate situation, but I know, especially looking at the US's healthcare from the outside, I read somewhere that was like, basically their healthcare system is like GoFundMe based because a lot of people, when they get into like situations like, for example, with cancer or like really expensive, illnesses that require expensive treatments, because it's out of pocket or they're not covered, they have to rely on like people's help from GoFundMes or donations in order to afford healthcare. So this is, I think, obviously because it's a TV show, like an exaggerated version of like the lengths people go to. I've seen diabetic people in the US having to go get their insulin from Canada. So yeah, it does make my blood boil because it's kind of like, especially with the US being such a rich country, that I know they got the money there. Like, I just want to say, if they just stopped spending so much on their military to terrorize the rest of the world, maybe. I'm so sorry. And maybe repurposed it a little. Yeah, I'm not the US's president, but like, y'all have no excuse. You get what I mean? Like, it is, they are a rich country, and their people should not be going through like such lengths in order to afford healthcare. That's all I have to say.
It's funny how you say that, Losa, because oftentimes when we think of universal health coverage, healthcare, it's the poor people that need
low resource settings, underdeveloped countries, Africa.
In this case, we're gonna look into high income countries and look into low income countries.
Absolutely.
But this is the US we're talking about. So the land of the free, the land of money, but healthcare is still a basic problem.
Yeah. That was unacceptable to me, but yeah.
100% to me, like I'm also triggered by this because I'm like, how are your prisons more well funded and a better environment to access healthcare than them?
Let's talk about the prisons, please.
Repeat that.
How can your prisons have better healthcare funding and services than your actual hospitals? That I don't understand how you can.
Like how?
I don't understand how you can allow that to happen.
The fact that there's so many prisons. There's so many prisons.
The prison system.
Listen. Up in prison.
You said I'd rather be in prison than stay outside here with
because
people.
The outside is death. Like his other option was literally dying.
Yeah.
And that's what it boils down to me. Like, it's, if you don't have enough money, you're dying. But there's treatment that could save your life, but you're dying because you don't have the money, which is ultimately just against everything I believe in.
Yeah.
Yeah. No, this is very, I don't know, tragic, catastrophic. And it kind of highlights why we're talking about this today. We're talking about the extent to which people will go through catastrophic experiences. This is a catastrophic experience. And now I'm going to dive into a few countries, like African countries actually, that I would say have relatively good healthcare systems and they still struggle in certain aspects, right? So there's South Africa. South Africa is currently facing a quadruple burden. So it has a burden of HIV and AIDS. It has a burden of chronic illnesses like lifestyle diseases, and it has a burden of injuries as well as a burden of trauma from accidents, road accidents and stuff like that, right? So they're facing this quadruple burden, and the system in South Africa is quasi-federal. So meaning that each whilst it is overseen by the government, the national government, it has ministers of health in each provinces. The problem is that whilst it has a relatively good healthcare system, pretty good, a lot of health professionals are leaving the country, and there's a shortage of healthcare professionals. So a lot of the systems in SA are basically like burdened, right? And now there's an issue with major out-of-pocket payments, and we're going to break down what these out-of-pocket payments mean. Do you guys want to chip in?
Yeah, so I mean, let me try bring in some of my actual degree. So out-of-pocket payments, from my understanding, is essentially how much you are actually paying out of your own wallet for health, right? And you can even split it in two ways. There's like the direct costs, which is like, okay, the cost for like the drugs that you need, the costs that are related to like, you know, the doctors and your medical appointment and stuff like that. And then there's actually also indirect costs, which is the money you use for transport to get to the hospital in the first place and all these other things. Or let's say the amount of money you lose if you are sick and, you know, you can't go to work. And so there's loss of income there. So that's essentially what out-of-pocket costs come down to. Out-of-pocket payments come down to. It's like how much out of your own wallet you are taking out for health.
Yeah, perfect. So essentially now South Africa has been put in a place where there has been people have had to spend a lot on out-of-pocket payments in terms of healthcare, which is problematic, because then whilst there are people that can afford it, rich people that can afford it, there's still a large portion of people that still can't afford basic healthcare needs. And we're going to go into a bit more detail about what that means. And then there's also Tanzania, which has sort of like, it has district level healthcare where the government would kind of make sure that would oversee the strategic decisions, and then at district level they would run the operations and actually delivering the healthcare. But it has similar problems of shortages of staff, shortages of healthcare professionals, and also these same out-of-pocket payments that seem to be a problem for the community.
Right.
Yeah.
So this just highlights how, yes, whilst you may have a relatively good healthcare system, at the end of the day, if any particular group is left behind, or if any particular group of people, such as older people or pregnant women or immunocompromised patients or people with lifelong diseases, they would get into very, very deep financial trouble if they were to afford that type of healthcare. So now I'm going to ask you all a question. Now, what do you understand by the concept of equality in health? Do you think we should aim for equality in health?
We aim for equality in health. Equality
in health.
See, my thing is there's there's so many different ways to answer that question, because then my first thing is like, okay, when we say equality in health, what does that even mean in the first place? Like, am I saying I want to achieve equality in terms of access for everyone to the healthcare services? Am I saying I want to achieve equality in terms of like the actual health outcomes, to say like I want everyone to be able to have a good level of health, whatever that health is. So those are the first questions I would ask
before we even ask that question.
Before even answer,
Before
like,
you
should
get
we have
to-
it? What do we mean by that?
Yeah, what is the definition of equality in health? Like, ultimately, like, for example, I think it is easier maybe to achieve like equal access to like certain types of health services, but like equal health in everybody. I mean, people have their own genetic predispositions, people have different social determinants. There's a lot of different things to address. And sometimes it's not feasible to make everyone's health the same and equal, whatever good health's definition is.
Like, and I agree with both of you, Edna and Loza. I think we even have to break down what exactly equality in health means.
Right.
Health means equality is not the same as equity. Equality in health means equal healthcare for everyone. That sounds nice, right? Everybody
beautiful
is healthy, but
beautiful.
I don't think that's even feasible.
No,
I don't think that's feasible, and I'm going to get into why. And there's equity, which means that you essentially, there's this idea of positive discrimination where you ensure that people that can't access healthcare still get it. So it's not necessarily equal. So it means unequal treatment for unequal people. So whoever is at an equal level gets treated unequally in a positive way, so that they can
so there's more focus.
Yeah.
The reason why my problem with equality in health, as Loza you said, is that first of all, genetically we're not equal, and then again that idea can be quite paternalistic, because now some healthcare conditions are very lifestyle based. So are you going to tell people are you going to govern and control people's behaviors and monitor people's behaviors? No, you can't do that.
It's not possible. You can make recommendations, but
you can't possibly do that. So again, it already comes with that problem of like, first of all, like we're not all healthy in the same way. So for us to achieve equal health, it's not even biologically possible.
Yeah. And if I was just to expand, maybe to give an example that could help people in terms of the difference between equality and equity. So equality could look like, okay, I decide to start an initiative where I'm like, I want to give everyone bicycles so that they can, exercise more, be active and better health and all these different things. Fine. We won't knock the idea yet. There's many holes, but let's say that's what I decide to do. If I say I want to approach this with the like equality in mind, it means I'm gonna give the same bicycle to everyone, the same size bicycle, the same kind of bicycle to everybody.
Yeah.
But the issue there is, have you considered the height of people? For example, children can't ride an adult bike.
Yeah. Some of us are short.
Some of us.
You have like what, 3 centimeters on me? It's okay.
You know the real numbers, Loza. Listen, I want to expose you.
We want to expose you. We're focusing on health, not height.
Sorry. Y'all started it.
But you see, already she's triggered because she's like, great, you give me a bicycle, but I can't ride it.
I can't ride it.
There's people
Thanks for the bike, Bob.
Yeah, there's people who maybe have some kind of disability that doesn't allow them to be able to use that kind of a bike. And we also know that bicycles differ in terms of like the seats for men and the seats for women and stuff like this. So I can't just give the same bicycle to everyone. That's what equality would do.
Right.
Equity, now that approach would then be able to say, I recognize that there's people and there's different kinds of people. Genetically, there's differences, my pre-existing, conditions, all these different things. So I can give you a bicycle that's more adapted to you. If you're a kid, I'll give you a bicycle that's suitable for a kid. If you're someone with a disability, I can give you a bicycle that's more suited to your needs. That's what equity would try to do.
I like that. I like
that explanation, Edna.
Yeah.
And again, like, if you think equity in health, what does good health even mean? As you said, like what does good health mean? If I was born with, I don't know, type 1 diabetes, good health would mean something completely different to me. As long as I'm able to get my insulin tablets, I'm good. you know. Whereas for someone else that has, let's say, an athlete, good health to them is a completely different thing. We can't achieve equality in health. Also, there are many other factors that contribute to healthcare, like your social determinants of health, your geography, your social factors, your household income, your education, how well informed you are. So yeah, that's why I don't think it's I don't think it's achievable.
Yeah. And I think, it's important to define these things of like what's equality and what's equity before we even get into like universal health, like health coverage and access to health for all, because definitions are important and what's feasible and what's not, you know?
It's good to clarify that. Now let's dive a bit further into this equity word. It sounds beautiful. We've mentioned it so many times.
Yeah.
On our Insta bios.
We love equity here.
Everywhere. We love the word equity. We promote equity. What does that mean?
Yes.
Now let's give an example, right? We're all in a pandemic, in this panoramic.
It's Panasonic.
When COVID was still an outbreak, when it was still in one specific location, when it was still, let's say, in China, right? Where it started, right?
Yeah.
Initially, you think outbreak, and let's say if we had, hypothetically, if we had a drug for COVID, like a treatment for COVID, right? And it came out, we'd all be happy. And now, let's say me, I'm a policymaker, and I decided, okay, I may start off with distributing, making sure that everyone has this drug. So I'd want to make it accessible to everybody. So that would be horizontal equity. Horizontal equity is basically saying everyone, all of you, get medication. Great, right? Essentially, I start to see that, I'm noticing that billionaires are having more and more of this drug. I'm noticing that people in China, or people in the capital city are accessing this medication, but people in rural towns are not accessing this drug. So I started to say, okay, there's a problem. There are poor people, and there are people that are not able to afford this drug, or simply not able to travel because it's very, very far. So I started to say that, okay, I'm going to come up with a policy or come up with an intervention that would distribute this drug to everybody, to everybody, to those people, particularly to those people. And so that would be an example of vertical equity, where I try to reduce the gap between the haves and the have-nots, right? So that's what we need to differentiate as well. When we're talking about universal health coverage, who are we targeting first? Who are we prioritizing? Because it's very easy to say that, everyone's going to have access to healthcare, but it's not possible because we have very limited resources. So we have to maximize them. Have more to add?
Yeah, I find the horizontal equity thing like interesting, because it is true. Your initial thing would be, okay, I'm recognizing that there's different needs, but then you also need to still recognize, different needs, for example, based on people's social determinants, their ethnicity, are they able-bodied or not, stuff like that. But you still need to recognize that even when you try adapt your policy to that, you need to pay attention to the fact that, I can't just provide the same thing to everyone and it's suddenly going to be okay.
Yeah, no, it's true. And there are even there are many arguments against equity. There are arguments against vertical equity. And there are arguments against universal health coverage.
Right.
Because what happens now? You want to increase access to healthcare for these groups, right?
Yeah.
Sometimes that would mean increasing taxes.
Right.
And then people get angry.
Yeah.
Ready for that.
Yeah.
But I wasn't ready for that, so I'm having to pay because someone
else's. Yeah, I think that's the hard part. I know, what is it? Universal health coverage. It's a sustainable development goal. We love setting the goals, but you really need to get political will. At the end of the day, global health and achieving these things, it's not just the job of a healthcare provider, but it's also you have to get the people to be willing. You have to get governments to be willing. Now, a government is not gonna promotes universal healthcare if it comes at the cost of taxing the people more, because then they're not going to vote for them the next time. So they're going to choose public appeal over, necessarily the betterment of health. So you kind of have to balance everything and get political will, which is, I think, the hard part achieving UHC.
That is the hard part. And we've seen countries like Switzerland, that have private health insurance systems, very, very well structured private health insurance systems. But at the same time, it's like similar to the way politicians would be inclined to act towards their own advantage and towards their own personal political campaign. In private health insurance systems, sometimes these systems are pricey, and they're actually not of the interest of the public or the patients, but towards their profits and towards their profit-driven health.
Profit-driven health, my favorite thing.
I have something to say about this. Hello, some of you may know I do live in Switzerland.
As a Swiss woman,
I live there, and I do pay for health insurance. And just to give people background a little bit about the Swiss system is health insurance. Everyone has to have health insurance. It's mandatory, but it's not like from the government directly. It's through private health insurance companies. So everyone has to sign up with some private health insurance company. And the thing, at least that's there, the protection for the public is they cannot deny you for the basic coverage, right? You cannot be denied wherever you go, any company, you have to be accepted. Now, the thing is, it is still you who has to pay for the health, like the monthly like premiums and all these different things. So that's what comes out of you as an individual. And of course, this helps because it means like there's enough financing for the health system that everyone will be able to access, the hospitals when you actually have a problem. There's enough financing to the government system through that private health insurance system that we have. But what happens is, for example, for me, my experience through that is then I'm young, generally healthy. I don't really have any pre-existing, condition and stuff like that. So I rarely have to interact with the healthcare system, but I still have to pay a lot for health insurance. So it just definitely makes me feel like I am paying for a system that I barely even use. But I understand the importance of it because we have to finance our healthcare some way, somehow. But this system, I feel, is already quite expensive. The only good thing here is in Switzerland, I guess it's balanced by the fact that, people tend to have higher incomes. They're paid generally much higher than in other places. So you can kind of cover it, but it still feels expensive. Yeah.
No, I can see that.
The problem with private health insurance is, it's the expense. Because some of them can be affordable, but a lot of them are quite expensive, especially in a country like Switzerland, where everything's expensive.
Everything's expensive here.
Adding health on top, it's just not a problem. Now, let's look into like African countries. Like African countries, a lot of African, when I say African countries, I mean the countries I referred to earlier in this episode, Tanzania, South Africa, even Cameroon, where I'm from. A lot of people rely on community health insurance. Community health insurance is basically when a community comes together, like members of a community come together and they decide to raise funds for somebody's health. So that's quite voluntary. And the good thing is that it comes from your family, it comes from their loved ones, and people usually tend to care and they would sacrifice themselves for somebody else, right? But the problem is that it still makes the rural and the poor people spend a lot on healthcare, even if they're not necessarily the one that you hear that your grandmother is sick or one of your uncles just got an operation that they can't afford. Everyone in the family has to come together and contribute towards it. And most of the time, these people can't even afford it either. So they do it, but it still puts that burden on the poor.
On people,
And it's kind of, I would describe it as regressive. Regressive meaning that it's when a healthcare system makes the poor people spend more than the rich people. It's when the healthcare expenditure comes more from the poor than the rich. And the healthcare financing comes more from the poor than the rich, whereas progressive meaning that the healthcare expenses are mostly funded by the rich rather than the poor. So I just think that these systems, it really depends on the context, and it depends on the country in which we're speaking of.
Yeah, that's true. Because I think even with the example of like private insurance, it is expensive here, but it works a bit better because the country has like enough money.
Yeah.
In other countries, I can see that being not as feasible.
Yeah, 100%.
Now, ladies, this leads me on to my next question. Okay. Do you think that universal health coverage is a feasible goal? I can start. Personally, I think it is. Mm-hmm. I think it is. It's feasible. Now, does that mean that would it mean policy changes? Yes. Is it contextual? Yes. Considering social, geographic, demographic, all these factors, it's feasible. Mm-hmm. What that means for different countries, that's a very different story. But I think it's feasible. What do you think, Rosa?
All right, I know it is like the goal to achieve it by 2030, right? Like the SDG. Mm-hmm. I don't know if it's feasible by then. I think it's feasible because that is what we're fighting. I mean, that is what we stand for. So if I didn't believe it was feasible, then obviously the whole point of my global health career is gone. But but I think when we say, like, I think we do need to define like what coverage is, what coverage means in different countries. I think it does require a lot of political will. I think it requires a lot of commitment. And community-based action, rather than maybe looking at it like at a global scale and being like, all of you countries, here's your goal, good luck. But really looking at like, kind of looking at it as a needs-based system and looking at what each country needs to achieve this. I know like healthcare professional shortage, like worker shortage is a big thing. Addressing that, giving people more incentives to remain in the country that they trained in. I know the WHO has like kind of, I think it's like a convention for that. But really putting that into action would be good. But I think, it requires a lot of work, but I think it's feasible, or I hope it is.
We have hope.
We have hope. We've improved since like 2000, so it's possible.
What about you, Garden of Eden?
Garden of Eden.
I don't know who came up with that, y'all.
That caught me off guard.
Yeah. I think it's pretty much the same as Loza. Like, yes, it is feasible, I think, but we definitely need to be able to adapt. Each country needs to be adapted to each country. My words. You need to look at the context of each country. It needs to take into account, let's say, cultural factors. Like Jocelyn said, there's a lot of community-based, what's the full term? Community-based?
Community health insurance.
Community health insurance. There's that sort of system, and it can work in some contexts, but it may not work in all contexts. Right. Places like here in Switzerland, where they can afford to have a system of private health insurance because many people are usually paid quite highly over here. So it depends on the country. There's no universal health coverage, shall I say. It's just going to depend on the country. But I think it's feasible. I
mean, the UK has tried, Sha. The UK tries with the NHS.
Yeah.
I know it gets a lot of hate, but it's still like...
Yeah.
Solid.
It's the publicly funded healthcare system. And, what we mean by essential health services, that's a different story. But, as long as primary care is covered and, some things that are usually costly in certain countries is free.
She said, like, you other countries, you know who you are.
Some of us don't. If you're British and you're complaining about the NHS, some countries can't even have a basic GP consultation.
It's rough.
Yeah.
Very
expensive.
It's very expensive.
Some countries it costs $5,000 to give birth. So
you know who you are.
You know who you are. I won't attack you again because I don't want your people to attack me. But you know who you are.
America.
You said it about me.
And also the final thing to consider when thinking about universal health coverage is that most of the time when it comes to these UHC interventions, it requires money. Administrative costs are a lot. So most of the time, even if the people are being taxed more, how much money actually reaches the people, it's not that same percentage that started off initially. So there are costs such as administrative costs, the lawyers, the government, the whole institutions that require also like infrastructure. There's there are different factors to consider. So it's not as straightforward. So let's kind of find a way to end on this note. Do you have any, even if it's just one, like burning policy recommendation? What would it be? One burning policy recommendation.
Let me think, actually.
What first comes to mind?
What first comes to mind for me is more an issue that just is, in terms of health in general, is how, like we're talking about, like we understand that healthcare and to provide good healthcare services is not cheap. It requires a lot of money, right? And how that money comes about, it will depend on each country, and it needs to be adapted to your country. But I still do think that overall, we do see that governments across the world, it's not just low-income countries, it's even middle-income to high-income countries. Their budgets for health already, I feel, are an issue. Like budgets dedicated to health are perhaps not prioritized versus the budget for our military, versus the budget for, I don't know, sports and culture or something like that. So I think it can also begin there. Of like, let's actually find a way to invest more money into our healthcare and like actually, you know, have more money for health.
Have more money and use it effectively.
That's true. I think, correct me if I'm wrong, I think the WHO's recommendation for healthcare budget is like 15%, right? At least 15%. And I've seen some countries don't even dedicate, where I'm from, sorry, my people, Cameroon spends about 4% of their healthcare expenses. It's 4%. So that's problematic. That's problematic.
That's a problem.
It's a problem. Like, healthcare is a very, very basic necessity. Just like how you need water, people don't choose to be ill. People don't choose how they. I mean, there's certain life factors that affect somebody's health, but when it comes to healthcare, that is life. And who determines the value of life? Who determines the value of someone's life? You know, it's not a product. It's not like I'm buying an iPhone.
It's not a commodity.
It's not a commodity. So yeah, it's definitely worth considering that as well. What were you saying?
No, I was just saying, using, I mean, more money needs to be there, but also using it effectively. I don't know. I think there are some countries where a lot of money is pumped into the healthcare, but then I believe it is not going to the right people in the right places.
In the right place, right places. And then we think of corruption.
Yeah.
All the other issues that come.
All the other places where the money just vanishes. But,
okay, now I'm gonna ask you a final hard question.
A hard question.
Do you support a publicly funded system or a private?
I'm gonna say public. I'm a bit of a socialist, but no, I only say public because I think it is more likely to be regulated and less profit driven. I think a lot of times when things are privatized, then obviously like money just takes over, and when things like health become profit driven, then obviously it's not for the benefit of the people that can afford things. So for that reason, I would say public.
Yeah, I completely agree. Public. I know everyone does not like, oh, high taxes and stuff like this, but I do think, like Loza saying, you made a great point. Like, you know, it's much easier for the financing of healthcare to be regulated if we say we include it as part of our taxation system. So a lot of places have like earmarked taxes, you know, which means that we have like a tax that's specific for, like, let's say this tax that you pay here is going towards NHS funding.
Yeah.
So systems like that, they help out a lot.
Wow, I agree. I think even looking at different countries, public funded systems tend to do better in terms of equity than private funded systems. While private funded systems can be well run and everything, there still tends to be a certain group of people that are left behind that still can't afford the health insurance schemes that are provided. So yeah, in terms of equity, I think public funded systems tend to do better. On that note, we're going to conclude. So thank you very much for listening to the World Health Investigation podcast. I'm Jocelyn.
I'm Edna.
And I'm Loza.
And we are 3 young global health professionals on the World Health Investigation podcast. So please follow us on our socials. We have Instagram at WHI_podcast, Twitter WHI_podcast, on LinkedIn and Facebook at World Health Investigation, as well as please subscribe to our YouTube channel.
Subscribe to our YouTube channel.
Subscribe right now, actually.
Right now.
I'm watching you.
Right now. World Health Investigation. Please support. Thank you very much and have a lovely rest of the week.